in some bread loaves, a couple of slices of bread will have a gram of salt in. So it's really high. And that's the reason the bread lasts as long as it does. If you go to France or Europe or wherever where they make their bread daily, they would die at the thought that you still had a loaf of bread that was sitting in your cupboard another week later. They were like, what is that? What is that horrible stuff that you're eating? That's not bread.
Hello and welcome to the Carecast. Pauline, how are you?
Thank you for asking me to your care podcast.
Really good. Love to have conversations with experts in and around the care world and on topics as important as things like blood pressure, which is really, really important health metric, isn't it? Which
Yeah.
is it sometimes ignored, or maybe it isn't, but it's something that really should be at the forefront of everyone's minds, I would say, because it's such a good indicator of general sort of metabolic health. But to start, could you tell us a bit about Blood Pressure UK's mission and what the organisation aims to achieve? Pauline?
So thank you for that. So my name's Pauline Swift. I'm a doctor. I'm a kidney specialist, and I'm the chairperson of the Trustees of Blood Pressure UK. And I have been for a couple of years. That organisation was set up by Professor Graham McGregor, who's recently passed away, which was a great loss for our organisation. But he did a huge amount to try and engage patients in their own healthcare. And so Blood Pressure UK was a charity that he set up with a view to actually raising the awareness of the importance of blood pressure, asking people to kind of wake up, learn about your blood pressure, know what your numbers mean. So we all know where our height is, we know what our weight is. And he really felt strongly that people should know what their blood pressure measurements were because high blood pressure is one of the biggest killers in the whole wide world. There are decades and decades of research, all published, showing that if you treat high blood pressure, your risk of dying from a blood pressure related cause goes down to the normal level. So it's one of those things. It's not like a cancer, which is, really hard to treat and whatnot. You can treat this high blood pressure, but if you don't know what your numbers are, you don't know that your blood pressure is high, and therefore your risk of having heart disease and kidney disease and the consequences of high blood pressure are great. So Blood Pressure UK was established to try and raise awareness of blood pressure and to give information to patients directly so that they could manage it themselves really and take control by knowing what blood pressure numbers meant.
Absolutely brilliant. Pauline, it is a charity, isn't it? Yep. And does it get central government funding as well as some charitable donations, or is it purely just?
No, it's a charity that exists, patient subscriptions, and then we sort of try and have some corporate sponsors. And it exists on a very low budget with a very small amount of people working in the charity.
Yep.
And obviously I don't cost anything. A lot of people are volunteering to work in the charity. It really only has about one paid working member of staff at the minute.
Really?
Yeah, so it punches up quite a big weight for a very small charity.
Back to your original point, it is critical and important. You cannot be healthy if you have high blood pressure, even if you're slim and young and whatever. If you were to have high blood pressure, it categorically means that you're not. There's something that must be wrong.
Well, that's right. It carries with it an excess risk of heart disease, so heart attacks, heart failure, stroke being one of the massive risks of having high blood pressure, which is obviously a really devastating event if you have a stroke.
Yep.
And what people sometimes really don't appreciate is it contributes to vascular dementia, which again, is terribly frightening for people, and chronic kidney disease. Your blood pressure is looking after all your organs' health, really. So if you've got high blood pressure hitting your brain, your kidneys, your heart, then those organs come under strain. It causes damage. Normalizing your high blood pressure into the normal range is easily treatable and protects your organ.
Yep. With the founder of the charity, Dr.
Graham McGregor.
Graham McGregor, of course. Was there any sort of moment where he just said to himself, we need to do something about this? this is being overlooked. It's so important and actually so easy to measure, and it would be so impactful if we
Yeah.
could do something. Was there a eureka moment for him?
I don't think there was so much as a eureka moment. He spent his life campaigning really to try and improve the health of the nation.
Yeah.
And it all focused really on pressure and our diet. At the same time as founding Blood Pressure UK, he said to me when I was a very junior doctor, he said to me, Pauline, we won't control this nation's blood pressure if people don't get engaged in their own health. So it was really, that moment was just like, let's bring people on the journey with us. Let's let people know how important this thing is. And at the same time, he then campaigned on sugar and salt, mostly salt, the salt in our diet. So he campaigned with government, tried to get a really important message of reducing salt in our foods down. And he campaigned first in the UK and then globally and managed to reduce the salt content of many foods across the world and thereby reduce population's blood pressure, which is a really, really important thing to do.
No, absolutely. Obviously, the NHS is the National Health Service, and he actually took that literally, didn't he? And he was focused on health more than illness. And if you do focus on health, obviously, that's the way to do it. It's better to stay healthy than to cure an illness.
Focus on health and prevention of illness. Absolutely. And there's so much that we can do to help our own health and prevent illness. But sometimes you feel like the whole world is really against you. So when I went to my grandmother's house, that's 2 generations ago, right? You would go in there. There was no such thing as processed foods. You would look in her cupboards or her fridge, and there really wouldn't be anything that you didn't have to make from scratch. Now you walk along your supermarket corridor, and it's just teeming with stuff that's highly addictive. All the salty, fatty, sugary foods, and they're easy and they're convenient. And the really important thing is they're cheap.
Yeah.
So
I'm not sure they're cheaper than whole food, but maybe they are, maybe they're not. I'm not sure about that, but they're certainly very unhealthy for you.
Very available.
What I think about processed food versus whole food is that if you were given an unlimited amount of whole food, you probably couldn't eat yourself into the sort of conditions that a lot of people experience every day now from, who have 80% and above processed food diet. You literally couldn't make yourself that ill if you ate the right food and if you force-fed yourself.
Yeah.
But yes, I would get rid of processed food.
The thing run away with itself in the last 10 to 20 years. It's become so available and terrifyingly so that you have to try and educate people how to eat a sort of normal, healthy diet, cooking food from fresh.
Yeah. But what are the primary lifestyle factors that contribute to high blood pressure, and what simple changes can individuals make to reduce their risk?
So contributing to high blood pressure really is lifestyle factors, and diet being the very most important of those things.
Yep.
So if you have a high salt diet, that will push your blood pressure up. With some people, it will push up their blood pressure a lot more than others. There's people that are salt sensitive, but in everyone and in the population, importantly, dietary salt is the major risk factor for high blood pressure. But along with dietary salt is low fruit and vegetable intake. So if you've got high salt, low fruit and vegetable intake, that's a big risk. So we would say cut the salt down, increase your fresh fruit and vegetable intake.
What's where high salt increases blood pressure and more fruit and veg or greens or whatever reduce it? What's that?
It's a highly integrated system, right? So our bodies are evolved. They're evolved to survive. So if you lose salt and water very quickly, like a diarrheal illness in childhood, you need to have salt retaining mechanisms so that you don't die from that. So we're evolved to retain salt and water, and that will maintain our blood pressure, which will perfuse our brain and our vital organs. But if you have too much salt, then your kidneys have this signal of trying to get rid of it. And so it puts the blood pressure up to try to get rid of the salt. So the kidneys are intimately involved in the pressure natriuresis. So it adjusts the pressure to try and get rid of the sodium salt. And then various hormone systems kick in as well. So it becomes a bit more complicated than that. But essentially, these are survival mechanisms. But then we've gone from, we're not really dying from childhood diarrheal diseases and illnesses, are those still in parts of the world people do. We're now in this situation where we have a really high salt environment that we live in,
Yep.
and we really don't need those mechanisms, and it all becomes counterproductive. So you get sustained high blood pressure to try and get rid of the sodium.
Yep. If you had to estimate someone who had an otherwise healthy diet but too much salt intake, and if they reduce their salt intake, how quickly should their bodies then be able to remove that extra sodium and adapt? Are we talking probably only just a matter of weeks or?
So it's a great question. Again, 12 to 24 hours, the
Yep.
blood pressure will come down. But in order to then clear the whole lot, it takes up to about 6 weeks.
Really? Yeah.
Yeah. So if you really, so you will see an effect quite quickly. If you eat a pizza or Chinese that's full of really high salt, your blood pressure will go up. And then it will fall if over the course of the next 12 or so hours. But if you've had a high salt diet and that's what you maintain in your dietary sort of pattern, it'll take about 6 weeks to desalinate and bring your blood pressure down.
Yes, interesting. It's again, it's so easy to eat far too much salt if you're eating processed foods and the wrong type of foods. I saw on an advert, I'm pretty sure that there's more salt in a slice of white bread than in a packet of crisps these days, of ready salted crisps, apparently.
Yeah. So
Which
in some bread loaves, there are a couple of slices of bread will have a gram of salt in. So it's really high. And that's the reason the bread lasts as long as it does. If you go to France or Europe or wherever where they make their bread daily, they would die at the thought that you still had a loaf of bread that was sitting in your cupboard another week later. They were like, what is that? What is that horrible stuff that you're eating? That's not bread.
no, it's yes, I'm of Italian origin and my dad wouldn't allow things like that into the house. He would, or that dodgy ice cream stuff, he would call that plastic. However, so for someone who has been diagnosed with high blood pressure, Pauline, what are the immediate steps that they should take, do you think, and what resources does Blood Pressure UK offer to support?
So if you've been diagnosed with high blood pressure, the first thing to do is to try and take some control of it. Okay. So this is something entirely manageable. And don't be frightened about it, because if you take control, that's always the best way to do it. Better to do something yourself rather than have somebody do something to you, right? So if you can certainly go onto Blood Pressure UK website and get some advice about changing your diet. So take control, know what your numbers are, right? So these are the numbers at the top blood pressure level, the systolic blood pressure at the bottom one. So when the heart pumps and when the heart relaxes, that gives you two pressures. So know what those two numbers are and then work towards trying to get it into the normal range or your blood pressure target. Change your diet, obviously, if it is high in salt, low in fruit and vegetables. If you're overweight, try to lose some weight. And that is really difficult. But if you're seriously overweight, now there are medications that are available to help you lose some weight. And this is, I'm afraid, sort of something that I'm seeing a lot in my clinic is young people coming in, much younger than that I was seeing 5 to 10 years ago, young people with real significant obesity and high blood pressure, and that whole metabolic syndrome that you vaguely mentioned earlier. So change your diet, know your numbers, drinking a lot of alcohol, reduce that into the healthy range as well. Try and be a little bit mindful and not be too stressed, although that's difficult to say. And then if it is still high, speak to your GP, your pharmacist about getting some treatment, because not everyone's blood pressure will be controlled by diet alone, because as I said, it's the biggest healthcare condition leading to heart disease and deaths from cardiovascular disease and kidney disease. So a lot of people will require medication. The number one thing I would say is please don't ignore it. It's not going
Yep.
to go away, not going to get better by itself. So number one, take some control. Please don't ignore it and take some steps, both yourself and with your GP and healthcare practitioner, to get your blood pressure treated down into the normal range. Take away the risk.
Yep. There is a blood pressure measurement where actually immediate and medical intervention would be required. What are the sort of measurements that would mean actually the safest thing would be to start being medicated for that?
So there is no hard and fast real rule because everything's a sort of
Yeah.
spread of risk, isn't it? So normal is below 120 at the top, 80 on the bottom. Getting high or diagnosed high in a clinic, 140 over 90. Really want to be doing something, 160 over 100, and severe, 180 over 120. Was all shades of grey, if you like. So
Yep.
anything over 140/90 measured at a doctor's clinic is high, and you need to take some measures, be that lifestyle or lifestyle together with medication. We always recommend lifestyle, but if you need medication, most GPs, most pharmacists will recommend treatment over 160 over 100 millimeters of mercury.
I see. Now, that's good information to have. Lots of people actually have their own blood pressure measurement tools at home. Would you recommend those? They're fairly cheap. You can buy them on Amazon for 30, 40 quid, something like that. Is there a particular mark of quality that people should look out for?
Yeah, so this world has changed. Blood pressure. We classically measure it using an upper arm cuff, and you can get those really cheaply, as you say, on Amazon, through your chemists, you can buy online, or from many different stores through the pharmacy. You can get them starting from about 20 quid. But they should have been validated. And by validated, there's a list. It's on Blood Pressure UK, British Heart Foundation, British Irish Hypertension Society validate these machines to say this is factually accurate for measuring your blood pressure as a medical device. So ideally, the machine is validated, right? And you can see those lists on BP UK and British and Irish Hypertension Society website. But more and more people now are using like wrist devices, cuffless devices, rings, none of which are validated. Okay, so there's a big lot of work being done at the minute by the British Irish Hypertension Society, by the European Society of Hypertension, trying to say, how do we validate these devices? So they need to be checked along with that cuff monitor to say these ones are safe to actually accurately measure your blood pressure. Because what you don't want to do is base a treatment on an inaccurate measurement.
Absolutely. When it comes to managing a long-term condition, if changes to lifestyle don't really help it to lower your blood pressure, what kind of care and support systems are typically available in the NHS and other organisations in the UK? Is it a question of regular monitoring and then potentially medication, lifestyle support, stress relief?
So this is a medical condition. Absolutely. So you need to, the people that look after our health in the UK is our GP services. Okay. You can get your blood pressure measured in a pharmacy. You can measure your blood pressure at home. You can measure it and know your numbers, and you can institute all the lifestyle things, but you can't access medications for blood pressure unless you go and speak with your GP or a prescribing healthcare person, such as a prescribing pharmacist. So you will have to engage with medical services.
Yeah. How can family members or living parents of people who are known to have high blood pressure or at risk of high blood pressure, how can they best support their loved ones or their clients, and what sort of resources are available to them? Is it a question of monitoring and then doing something if there's a problem? Is that their main sort of help?
50% of adults will have half of us will have high blood pressure. If you're over the age of 60, that goes up to about 60%. And as you get older, so this is something that will run in families. You will have a friend or a colleague who's got high blood pressure. You'll have family members that have high blood pressure. So best you all work together, really. And as I say, particularly if you're a parent with high blood pressure, then you need to be cooking healthy food for your children so that they don't have that risk growing up from their sort of young age and teens onwards. So work on it together, help each other, be healthy, do stuff, and take your medication regularly. So this is another big problem, is that people don't necessarily want to be on medications for something that's completely symptomless. And I get that. So they say, I feel completely fine. I don't see why I should have this medication. And so it's really about understanding why you're on blood pressure medication, what happens when you've got high blood pressure, why you really want to reduce that risk. So working with your friends and family to take the medication properly, to do the lifestyle changes. And that's easier if you're working with people that you trust as well. So you have to engage with people that you trust. Yeah. So not taking medications is a problem. And what I would say is if one medication doesn't agree with you, there are other ones that you can try, right? So if it doesn't agree with you, doesn't agree with you for a reason, go talk with your GP or prescribing pharmacist and try another medication. It might be that you need two medications in much smaller doses, and the combination will suit you better than a big dose of one particular type of medication. There's usually something that will agree with you. Encourage your friends and family to have their blood pressure checked, work together, look after each other, and get your blood pressure down into the normal range. And please use resources like Blood Pressure UK. They're very, very well. So British Heart Foundation, Blood Pressure UK, they've all got fantastic resources to acknowledge what high blood pressure is, how to treat it, what your blood pressure target should be. So please use the resources. They're there for you. Go onto the website and have a look around. And there is that little icon that says contact us. If you want to contact us, you can. There's a nurse that gives advice as well. So yeah, we'd be happy to engage with anyone who's got particular questions, but most information is on the website. Thank you so much for listening.